Hi, my name is Tashi Schuler-Drakes, and I am a Family and Community Engagement Specialist for Sparkler Learning in Connecticut. Thank you for joining our training about resources available to families in Connecticut. When families use Sparkler, they are tapping into a system of support. When they complete the screenings available on Sparkler, they can learn about their children's learning and development, and they can access evaluations, resources, and supports which are available statewide to families with young children. All families using Sparkler in Connecticut have agreed to share their child's information with the Connecticut Office of Early Childhood and the United Way of Connecticut's 211 Child Development, a specialized group of care coordinators that support children's healthy growth and development. Families might also be sharing with their school, family resource center, home visitor, or other provider. After screening, either 211 or your family school or provider is responsible for helping you to understand the results and connect with any support services your child might benefit from. In this video, we'll learn about many of those resources that are available across the state. In this unit, we are going to hear about the core support available to families and providers from our colleague, Kirsten Carlone, who is the lead care coordinator at 211 Child Development. Kirsten will review information that can help families, programs learn about the resources available. Families can self-refer to 211 Child Development in order to get answers and support. And they're also a great resource for programs. If you ever have questions about an individual child or what might be the best approach for helping an individual family, you should reach out to 211.
Hi, my name is Kirsten Carlone, and I am the lead care coordinator with 211 Child Development, and I'm going to be talking about some of the supports and resources that we connect families to. At 211 Child Development, we are a specialized unit within the United Way of Connecticut, and we support children's healthy growth and development starting from pregnancy. Our care coordinators speak with families or programs who have questions or concerns, and we can provide advice to programs. We provide an assessment of needs and referrals to appropriate services. We provide education on development, behavior management, and programs. We offer ongoing developmental monitoring through the Ages and Stages questionnaires, and we also provide advocacy and follow-up to families. When a family completes a screening in Sparkler, the results are reviewed by a care coordinator. The care coordinator will then share those results with the family and then offer information on interventions and supports if necessary. Next, I will share some of the programs and systems that we connect families to. The first program we have is Birth to 3, which is Connecticut's early intervention system. 211 Child Development is the central intake for the Birth to 3 program. Birth to 3 provides early intervention for families of infants and toddlers under 3 years old with significant developmental delays and disabilities. A developmental evaluation is provided to the family at no cost for children who are suspected of having a delay. If the child meets criteria for the delay, or if they're eligible, the family will receive an Individualized Plan of Services and Supports, or IFSP. The program can support families in helping their child develop and learn through everyday activities and routines. And the family can also receive coordination of supports and referrals to community services. To access Birth to 3, families can call 211 Child Development at our direct line, which is 1-800-505-7000. Families can also make a referral online on the Birth to 3 website, which is birth23.org. When families make their own referral, they're consenting to having an evaluation, so it expedites the process. But providers can also make a referral for the families too. We will just need to check in with the family and make sure they give consent for the evaluation. Help Me Grow is a system that connects Connecticut children and their families to community services and resources related to child health, behavior, development, and learning. Through Help Me Grow, care coordinators can provide education around recognizing typical developmental milestones, as well as support for specific developmental or behavioral concerns. We can provide information on various parenting issues, such as toilet training, behavior management, or sleep issues. We can also connect families to existing community-based programs, such as family resource centers, parenting aid programs, home visiting programs, early childhood consultation services, other parenting supports, and more. Through Help Me Grow, we also offer ongoing follow-up to ensure that the family is connected to services and that their issues have been addressed. Home visiting is for people who are pregnant or have young children and could benefit from in-home support services that promote positive parenting and healthy development. This includes pregnancy-related information, linkages to healthcare, childbirth education, and nutritional supports, and also intensive support for parenting and healthy child development. Children and youth with special healthcare needs is for children and youth with chronic physical, developmental, behavioral, or emotional conditions who require more health or related services than other children the same age. Care coordinators will complete a service needs assessment with the family and then connect that family to the Department of Public Health's local medical home site. Through care coordination at the site, the family can receive family caregiver support, educational support, respite planning, coordination of medical care, and help with transition services. To access these programs, families and providers can call our direct line at 1-800-505-7000 to talk with a care coordinator. Providers and families can also make an online referral on our website, which is cdi.211ct.org. Thank you for joining us. If you have any questions, concerns, or would like to hear more about these programs, please contact us. Our care coordinators are available Monday through Friday from 8 a.m. to 6 p.m.